going to read your bio. Thanks. With a strong foundation in mental health and developmental services, Katrina has dedicated her career to fostering psychologically healthy and safe workplaces. As a certified psychological health and safety advisor and assessor, she helps organizations integrate well-being into their culture, not as a one-time initiative, but as a key driver of success. She specializes in guiding employers through strategy development, operational planning, and policy integration, ensuring that psychological health and safety become fundamental to the way they work. Rooted in curiosity, problem solving, and continuous learning, her approach empowers leaders to create environments where employees feel valued, supported, and able to thrive. Whether through training, consultation, or strategic advising, the mission remains the same: building healthier, more resilient workplaces. So welcome, Katrina.
Thank you so much for having us. And yeah, I'm happy to answer any other questions if people are interested in the assessor training as well, whether it's that you're interested in learning about the assessment or if you're interested in becoming assessor. So feel free to ask those questions as well. So my name is Katrina Burch. I'm a workplace wellbeing consultant with Public Services Health and Safety Association. And I'm here today to talk to you about our most recent survey that was looking into the drivers of well-being, what well-being means in the Ontario public sector. So our learning outcomes today are defining what workplace well-being means to Ontario workers, leaders, and employers, specifically in the public sector. Understanding the key drivers that shape the workplace experience, and explore the divergent perspectives of workers and employers, and identify how we might be able to bridge that gap between the differing perspectives. So when we, as a health and safety association, are looking at, developing or creating products, we really want to look at using a data-driven approach to developing the services and the tools to support Ontario public sector workplaces. So we wanted to understand how workers were defining well-being so that we could guide our journey on what is workplace well-being and how can we best support workplaces with that. So last year, in partnership with Mission Research, we launched a workplace well-being survey to employers, supervisors, and workers across Ontario. In the survey, we asked senior leaders, managers, and workers in all levels what workplace well-being means to them and to share that in their own words. So across over 2,100 Ontarians, the dominant themes of well-being were not just health related. They really centered around a feeling of being respected, valued, and having leaders who listen. So we'll keep that in mind as we go through the rest of our session. So this is an expanded list of the themes. So there were several ones that emerged. So this is a typical word cloud that, the words that are bigger, we saw come up more often. So that included things like physical safety in the workplace, mental health or psychological safety, healthy and supportive work environments, work-life balance, job satisfaction, having supportive management, having programs that supported health and wellness, having respect and dignity in the workplace, or good reward and recognition programs, having some clear communications, being provided with regular feedback, being a part of a team and having the opportunity for collaboration, and also having the opportunity for career development. So for those of you who aren't new to the, to the CSA standard, you might hear some common themes in there. So it was really interesting that with zero prompting at all, just some very general questions, the responses that we were provided with really did align with the psychosocial factors that are outlined in the standard. So the next dimension of the survey had participants rate components and dimensions of well-being, from not at all important to extremely important. So what are components and what are dimensions? So components are like the broad categories that represent key aspects of workplace well-being. So you can think of them as like the main pillars or building blocks of well-being in the workplace. They help organize the overall concept of workplace well-being into more manageable and focused areas. And examples of this could be things like organizational culture or leadership, maybe workload, and some that we asked about were things like influence into work processes, diversity, equity, and inclusion, and accessibility programs, financial security and predictability, manageable workload, occupational health and safety, reward and recognition programs, work life balance, all kinds of components in that. Then we also asked about dimensions. So these are specific elements or sub-themes that fall under each component. So they provide a more detailed and nuanced look at what contributes to or influences each component. So dimensions help describe how each component is experienced or operationalized in the workplace. So for example, under organizational culture, we might talk about psychological safety, trust, respect, or under leadership, we might talk about authenticity, supportiveness, or role modeling. So, like, basically, if we were talking about a book, the components are the chapters in a book about workplace well-being, and the dimensions are the specific topics or sections within that chapter. So, from all of this survey data, we at PSHSA define workplace well-being as your overall experience of health, safety, and support at work. It's achieved through a balanced, collective approach to protecting and promoting workers' psychological or physical and psychological health. So why is all of that important? So what's the organizational impact on that? So we've heard a little bit about that already today, but investing in well-being isn't just the right thing to do, it really does pay off. So most employers saw improvements in retention, engagement, and health outcomes. When we see that only so again, this is based on our survey data. When that only 34% of workers believed that there was momentum towards that change. So there's clearly work to be done based on that divergent view. So we'll talk a little bit about that in a bit. So in the survey, it was found that when grounding a program in a well-being standard, successful outcomes were noted. So when we talk about things like the CSA standard for psychological health and safety, or the Excellence Canada Healthy Workplace Standard, or WSIB's Health and Safety Excellence Program. So when we were looking at standards like that, it was found that there are successful outcomes. So we asked employers whether they had adopted or implemented a standard and if they've seen any improvement in human resources metrics over the year. And what we found was when looking at workplaces by size or union status, there was a clear connection between adoption of a well-being standard and the overall improvement of human resources metrics. There was also the greatest improvement being seen in smaller workplaces and unionized organizations. The implementation of an accredited workplace standard is also linked to significant positive return on investment. So we heard Liz talk about that, the ROI across all key human resources metrics, and the highest gains were observed in worker retention and new hire attrition. There were also improvements in key human resource metrics that are generally these improvements were seen in public safety sector, and we saw that in the lowest gain in these metrics in the government sector. So this aligned really clearly with the highest and lowest levels of implementation. So public safety sector had the highest gains and also the highest implementation. Government saw the lowest gains, and respectively, they also saw the lowest gains in those human resources metrics. It's also important to note a few other things that public safety employers reported significantly greater gains in worker retention and reduction in disability claims, while the education sector saw more notable gains in retention, while government employers are less likely to have experienced improvements in any of these areas. So those are the impacts of that we were able to show related to implementing a standard. We also saw improvements in these metrics sorry, I already went over that. Sorry, duplication of slide. So then let's talk about the drivers of workplace well-being. So what are the factors that impact the workplace well-being? So of the over 2,100 survey respondents, we saw 92% report that a work environment that promotes psychological safety is a key part of their well-being. Workers place significant importance on the components of occupational health and safety as well as workplace well-being, and report that core dimensions of workplace well-being are financial security, psychological safety and emotional well-being, and having a flexible work schedule that allows for work-life balance. So again, when we're talking about those overall, like the chapters of the book, they really saw these areas as most important for workers. The top workplace stressors that were talked about were psychological and emotional demands, workload, and the pace of work, or having sufficient time to do that work. So what was interesting was almost every well-being component that was rated was above 7.5 or above out of 10, but only a few of these were consistently available in workplaces. So when people said these components are important, very few of these components were actually available. And the gap between what workers value and what's available is where that change really begins, where we can start doing some of that work. So when we look at this as it relates to the employers, so employers rated the components of workplace well-being differently. It showed that all felt that components were at least somewhat important, with adequate job resources ranking the highest, as well as rating work-life balance and financial security, as well as or security and predictability lower than workers. They also placed a greater emphasis on recognition and reward programs than workers did. While all dimensions of workplace well-being were considered were considered important, employers put their top priorities as psychological health and safety, the prevention of physical risks or hazards, and financial security through work. So diversity, inclusion, equity, and accessibility was notably rated lower among leaders versus workers. Although employers and workers agree on most aspects of workplace well-being, there was a big difference in the prioritization of financial security, with the greatest differential in the ranking. So although there was financial security on both of their lists, there was a really big gap between how workers rated it and how employers rated it. Both groups do consider all aspects to be at least somewhat important, though. So we'll dive a little bit deeper into the employer and worker perspective differences. So research did find that there were several areas that workers and employers different. So employers outline their organization's approach to workplace well-being across multiple dimensions, emphasizing holistic health, so including physical, mental, emotional, and social well-being, as well as work-life balance and flexibility. And they also highlighted the significance of a supportive organizational culture grounded in empathetic and accountable leadership. Additionally, additionally, having access to tangible support such as well-being resources and programs, it's recognized that it's essential to fostering a workplace well-being. So when we look at the differences, employers really focused on strategy and policy, and workers spoke primarily on the reality, so that experiential existence of workplace well-being. So the realities they talked about were things like excessive workload, toxic management, whereas employers were like, we've got policy, we've got strategy. So understanding this gap is crucial for effective action. We also see in a difference in leadership and culture. So employers emphasize that empathetic and accountable leadership, while workers really highlighted poor management, micromanagement, and lack of supervisor support as really major barriers. And then that next gap is between idealism and reality. So employers outlined like the aspirational goals, while workers really talked about the real life stressors they're facing every day. So high workload, unrealistic expectation. So understanding these differing perspectives can really help us to understand the gap between the programs and the worker experience. So when you reflect back on our definition, it really is about that feeling of having a workplace that's psychologically safe and healthy. So if that's the worker experience and then the gap between organizational programming, how can we close that? Um, so what are some ways that we can do that? We've talked about a lot already in this presentation, but there's some other things that were highlighted in our survey that can really help to bridge that gap. So having a formal policy for workplace well-being, ensuring adequate staff resources to support this work is important. So well-being is the joint responsibility, and having a clear policy and dedicated staff support this work. So whether that be a committee of workers, leaders, union representative, or it's combined with the joint health and safety committee, it's really helpful to support the alignment and the needs of the organization when having a formal policy. We also saw communication rated highly as a practice to support well-being. So that includes that, or that ensures that employers align their perception with reality. 76% of employers reported that positive momentum, whereas I mentioned before, only 34% of workers had that same opinion. So that's that gap between reality um, and idealism. So how do we close that gap? Some of that is through communication. So employers should focus on soliciting more direct worker feedback and ensuring that change efforts are perceived as data driven and inclusive. It's important to choose the appropriate method of communication. So workers rate communication methods for well-being policies less effective than employers do. While communication methods are seen as somewhat useful, while all communication methods are somewhat useful, employers consider in-person training the most effective way to convey well-being policies and programs within their organization. So that means, having information shared at all staff meetings or team meetings where there's that person-to-person connection, as opposed to, an email blast or a newsletter. Um, Workers rated other methods lowly, things like newsletters, YouTube, text messaging, and podcasts, less effective than employers do. So again, that, workers want to have that conversation here first person, as opposed to employers who believe all of the other communication methods are effective. The other thing we heard was that workers report that well-being programs are less available than employers think. So there's a significant gap in the employer and worker perception of this access, and also the effectiveness of the program. So employers express strong confidence in the availability of various well-being supports at their workplace, especially programs focused on ergonomics, workplace safety, health insurance, compensation benefits, DEI efforts, and work-life balance. And with the exception of health insurance and disability management programs, there were significant gaps between the employer and worker perception of the access to them. There were also reports of the challenges with being able to access the supports, that there were a lot of barriers or a lack of understanding of how to access these tools. And then the implementation of a well-being standard is linked to significant return on investment on human resources metrics. So about 3 in 4 employers have implemented at least one of the different 6 well-being standards that we tested for. The most important factor influencing the implementation of a well-being standard or program is to increase productivity and workplace engagement with staff, followed by protecting the psychological health and safety of staff. So those are reasons why organizations might implement a standard. The large majority of employers have seen improvements across all human resource metrics in the last 12 months once they've adopted a standard. And the implementation of an accredited standard is linked to significant ROI. And those highest gains were in worker retention and new hire attrition. So what are the next steps? So understanding how workers and employers experience well-being, the key drivers and the practices that you that will set you up for success are the first step in moving forward on the journey to workplace well-being. So the research completed with Mission is specific to the Ontario public sector, which enables you to make the decisions based on current local trends. So here's some actions that you can take away with you today. So we have some tools at PSHSA that will help you do this. So Radius is a tool that empowers workplace to understand job-based risk of psychological harm and collaboratively identify actionable solutions to enhance worker well-being. We also have the OSIR, which is an evidence-based, purpose-built tool for assessing a workplace's vulnerability to occupational stress injuries. And then there's also on our website a large resource catalog with documents like job demands descriptions, a structured process to identify physical, cognitive, and psychological demands on the job. We have a PHS check-in. We have a PHS guide that helps you set up sort of your program from beginning to end. And like Liz was talking about, like that idea of implementing or adding psychological health and safety into each of the programs you already have or each of the tools you already have based on OHS. So it's also really helpful tool for JHSCs to be able to use the tools to actively promote psychological health and safety in the workplace. We do have an upcoming in-person event that will go over this survey in with like a deeper dive into the survey. Mission's actually coming to a few of our days to present. We also have a lot of our systems partners coming out. So the ministry's coming, WSIB. So I think WIWH is coming as well. And there's a lot of information on the website, and a lot of our partners are coming to share more information with you. And if you have any other additional questions or want to reach out to learn more about our services, please feel free to do that. You can use the QR code to link to our website, or you can grab my email or phone number there at the bottom. And I will stop sharing.
Thanks, Katrina. That was interesting to see the results and the gaps. As you say, someone actually asked about posting the survey. So is there a report from that's on your website? I couldn't find it when I looked quickly.
Yes.
Of results?
Yeah, the survey, we just actually finished, it was a two-part survey, and we just actually finished the second portion. I want to say like last month. So the final survey and all of the details will be posted on our website in, I would say, probably another 3-ish months. So it is coming. We will make a loud presentation or a loud promotion around that survey when it is fully available.
And is the survey that you used, I mean, it was brought across to multiple employers and their workers, I guess. But is it adaptable to be used internally in one organization in order to find out if the management and the workers have different perspectives or different understanding of lived experience?
Um,
Or is it more a study thing?
yeah, I would say it's more of a study. So it's not necessarily a tool. We use the study to determine sort of where's the gaps, what are our next steps, how can we best support our sector partners to make sure that we're aligning with what their needs are.
Okay, thanks. John has his hand up. I don't know if you can unmute, John. Go ahead. Turn on your camera too. Let me just see if you can unmute. Oh, let me request. Tony, maybe you can unlock the mics. John, you should be able to unmute now.
Maybe if you add them as a host, if you
Okay,
have that
there we
ability.
go.
Oh,
Yeah.
No, thank you very much, Katrina. It really blends with my experience in the field, doing surveys in workplace. That gap between the different perspectives. It's like there's two different languages going on, and it's a great role for your organization to be a translator to get them talking. Thanks for your presentation.
Yeah, thank you, John.
Yeah, I thought so too, and I would be interested in your, in the reflection back to the audit tool that we heard about previously, that for which you're now an assessor. I didn't get the chance. One of my questions I wanted to ask Liz was about the Joint Health and Safety Committee involvement and engagement with that, and how much that was, sort of reinforced in the implementation model of the assessment, or how much weight or value the engagement of the Joint Health and Safety Committee was in that audit tool. But I'd be interested as an assessor, how you've been taught, or what's related to that, and how do you, because it's a measurement of a management system, and have they got the binders? Have they got the this? That, and is it on the agenda? That's one thing, but how do you actually assess that's what's really happening, and what the perception and the experience of the workers in that organization are when you're trying to do that assessment?
Yeah, so when I did my first, sorry, I'm just seeing the question. So to clarify, is this survey and its results connected with the survey we heard about?
No worries. So I asked a question now about because, so you want to answer that? So yeah, answer that, and then we can discuss how do you measure worker experience in these processes?
Yeah. So I think if I'm reading that question correctly, the survey I shared isn't connected to necessarily the Mental Health Commission of Canada's assessor, or IWH, which IWH does do a lot of work for us with our tools. So, but yeah, I think that's what you're saying, GFB. So to answer your question, how we include the worker perspective. So Liz had mentioned that there's an interview portion. So I did my assessment with quite a large organization of about, I consider large. It was like just over 400 people, but had multiple sites and multiple services within those sites. So to make sure that, like you're saying, it's not just as simple as like reviewing the documentation and checking the boxes. It was really having a conversation across all sites and services, regular 9 to 5 employees versus 24-hour shift employees, and having that conversation with them. So there is you ask, do they have these tools? And it's not to trip people up by any means, but it's also, you don't say, you're not just looking for like a, do you have yes or no? It's sort of like, tell me your experience with this situation or with this tool related to the 10 elements that Liz had talked about.
Mm-hmm.
And so it's making sure, for one, that you're getting sort of all levels of the organization, all services, all locations. And then there's also the added element that you need to make sure that you're interviewing Joint Health and Safety Committee members, you're including EDI committee members, and you're including Wellbeing committee members if that's separate from their JHSC.
Mm-hmm.
So, and the number is quite high. So out of just over 400 employees, I needed to interview, I think, 68 of those employees to make sure that everything was aligning.
Great, thanks. That's interesting to know that it and build on the 45,003 definitely includes that level of worker engagement at every level, I think. So I'm interested. I want to revisit Dorothy's comments about nomenclature, maybe with both you and Peter and John and Daryl and anybody else who wants to chime in. But I also want to, I guess, is based on the results of this, which I appreciate, some of them just came in recently, is PSHSA consciously working on any new products focused on worker engagement and worker empowerment, and related to the integration of psychological health and safety into occupational health and safety? I guess, are you reflecting on that in terms of product offerings or service offerings or anything like that?
So one of our newest tools that I mentioned quickly is Radius. So that's a psychosocial risk assessment at the job level. So whereas the Mental Health Commission of Canada's Assessor is really at an organizational level, this is really at the job level. And again, it is around including the worker in assessing the risk. So so when we do an assessment, we meet with not only the leaders, but we also meet with the employees who are in that role to have that conversation. So we really try to make sure that all of our tools, our assessments are really focused at engaging all levels. And then we have also just released a number of tools on our website that are specific to JHSCs and how they can support psychological health and safety in the work.
Great, thanks. So yeah, just I guess there were a couple questions that came up, Peter, in your first talk that I think are related to all that we've talked about here. So the one from Dorothy, which I guess maybe you've seen, is that that words matter, safety is different from health, and so the question is, what are the consequences of using risk instead of hazard, and safety instead of health for the this job related hazard, I guess, meaning psychosocial factors, and how might using risk and safety constrain the understanding the full range of health effects from psychosocial and work organization hazards? I don't know if you have any.
So I didn't see the question, sorry, Val, but I can answer the second one. The first one, maybe Dorothy has an answer, or John does, about the difference between risk and hazard. I see them as synonymous, but I would say that the challenge with safety, talking about safety, is it tends to focus on only the things at work that can cause harm. Whereas I think when we talk about well-being or health and safety, it should hopefully draw us to focus on how do we promote the positive aspects of work as well, because just preventing symptoms of mental illness or preventing injuries shouldn't be the goal. I think in a really progressive workplace, it's about making work meaningful. Mm-hmm. That can sometimes get missed when we talk about safety.
That's fair, and often physical safety comes to people's mind when they think of the word safety as well. But John, did you want to add something?
Yeah, WorkSafe BC has a nice video on the difference between the words risk and hazard, and I'll put it into the site. But briefly, risk includes an assessment of severity, probability and severity, where hazard is more a property of the activity or the substance, and it's not as quantified, but I'll put it into the video, or into, I do talks on hazard evaluation versus risk assessment, so it's a topic near and dear to my heart. And I use this video in that presentation.
Thanks. Dorothy, do you want to add?
Yeah, likewise. It's in my experience, the word risk tends to be used to underplay the hazards involved, and you get involved in arguing about how much risk is there from a particular hazard, as opposed to saying what can we do to fix it. So there's those consequences of using the words, and also that in using the word safety, when as a hygienist ergonomist, I think of those as sort of mechanical and sort of immediate kinds of issues. So you trip over something, and it's a way again of underplaying if you look at the 6 categories of hazards, it's a way of really underplaying in undermining health effects. And so I just get worried when I hear psychological safety, and people might think about it being violence, for example, because it's sort of there is certainly a safety aspect to that. But there's also the health consequences. And there's widespread health consequences from all kinds of other hazards that are related to, whether you call it psychosocial, and there's issues with that word as well historically, or work organization or stressors, whatever. And my mantra is hazards to the mind become hazards to the body, and we need to try and address all of them and try and fix them. Sometimes, as Peter, as you said, they're sort of immediate short-term and long-term effects, but there's also immediate short-term and long-term solutions. And that's what I'm particularly interested in. So, but I worry about the consequences of using these words that frankly tend to be used more by management than others, and that really downplay the consequences of the harm that's done.
It's interesting. I don't know if Katrina, you wanted to add anything. I have seen, I guess, I think safety is being used to try and normalize and integrate the psychological risks, I guess, or that, the recognition of the hazard into existing health and safety. So it's almost, and I think that, that we run into the problem often that people think that, yes, workplace mental health is a problem, but they focus on the mental health and the sick worker as opposed to the sickening workplace or work practices. So it's, but are we downplaying in the other direction then? So I think safety is used to mainstream, I guess, issues that used to be marginal, and there's a little talk about psychological hazards or psychosocial hazards, but that's not our main business here. Our main business is preventing falls or whatever. So, but Katrina, did you want to have any comment to add related to these hazard and risk and safety and health and psychosocial and psychological? Because they do all have meaning, and then they have different meanings to different people.
I think John says it best in the comments that safety is acute health and health is chronic safety. So I really think he kind of sums it up there.
Yeah.
There is also the comment of like the worry of the consequences of using the term well-being instead of psychological health and safety, or safe and healthy work. And that there's a feeling that it focuses more on worker-based solution rather than focusing on the environment. I think that's sort of where this conversation's about, is I'm like, I look at, I prefer to use the term well-being versus wellness, because I feel like wellness focuses specifically on individual either illness or wellness versus hi Dorothy, versus like that it's more around an individual and their either diagnosis of wellness or illness, whereas well-being is more around that holistic experience. And yes, we're focusing on these things in the workplace, but we also recognize that we take work home and we take home to work, and that worker well-being really allows us to focus on how providing a psychologically healthy and safe workplace in a health and safety management program allows you to be well at work, which allows you to be well at home, and vice versa. So for me, it's sort of that more holistic look at well-being, and that we are individuals when we come to work, but what can we do to make, like Liz said, how can we make work the best place it is to be?
Thanks, that was helpful. And I think Peter, your comment earlier, which is related to what you're just saying too, Katrina, everybody has these catchphrases. So work is a healthy part of a healthy life has always been my mantra in a long career in human resources and environment, health and safety, and in occupational health, more focused here at OHCOW. And I think the concept of people thriving and the benefits to them individually and collectively, and to the workplace, I think is without using the word productivity. So productivity obviously came up in your survey that the management thought that, they were putting these, whatever structure or framework in place to boost employee well-being for productivity. And obviously that's a reality, but I think that thriving people, has multiple benefits in the interactions with their peers, in the quality of life, basically, I guess. And I think I don't have it at my fingertips, but the isn't it the ILO or the WHO definition of well-being includes that sort of, thriving life kind of thing. So that's what I guess it's all our goals. But there was one more question I pasted in from earlier in the chat, and it was around integration, which is sort of some of the whole discussion. But that was after your talk, Peter, but the question was, how can we integrate these interventions, models, and resources with the workplace factors defined by the Psychological Health and Safety in the Workplace Standard by CSA? So I guess we've struggled with that a bit on our, using the COPSUC factors and then stress assess with its added dimension. How does it map back? But I not sure even in general. Ought we to map it back, or should we have other language?
Yes, I think. Well, I guess I'd say two things. One is that I think the implementation advice given in the standard is good advice. Like, it talks about management commitment, talks about worker participation. Probably one of the hardest parts about the standard is actually the 13 factors. And the reason the 13 factors is a problem is because we don't have a measure that can isolate the 13 factors. Not that I've seen in the peer-reviewed literature. I've only seen one study in the peer-reviewed literature, which was one by John and I, which showed that it couldn't do it. And that, I guess, the challenge there is that if you wanted to go in for these 13, so I'm not saying those 13 dimensions aren't right. I'm just saying we don't have a measure to measure those 13 dimensions that we could use. And if you were a workplace that did a deep dive and wanted to isolate some dimensions and see if they improved in others, it's a bit hard when you don't have a questionnaire you can put in that can isolate the different dimensions from each other, which I think the advantage of the ones in the COPSUC is that they do. I don't think it's by chance that if you look at the ISO standard, it uses the more traditional dimensions that we see in the demands, control, organisational justice. All of the Australian stuff tends to use those same types of dimensions. So, I know that the standard has been reviewed, and hopefully it'll align a bit more closely with the international standards and the other literature. But again, I just want to stress that which I think came out with the audit and with Katrina's stuff, is that intervening in the psychosocial work environment is way more than putting a survey in. A staff survey does nothing unless you act on it. And that's the things about these audits, which identify things outside of just putting in the survey, I think are really important, because they measure the commitment and they measure the participation of workers, which is the goal. If you have that in place, then you're moving. That's much better than using the best measure.
Yeah, and I think that that the listening to workers piece is threaded through all of it, really. If a survey is a way of listening, if you can engage and if they trust and complete the surveys, and it's a way of listening. But the Radius tool of sitting down and looking at a particular job and including workers in it, and similarly the way the audit that the Opening Minds has put together is going and talking to workers based on the ISO factors as well. So yeah, it will be interesting. We're hoping to get a speaker for the fifth session that might be able to talk about what's happening with that rewrite of the CSA standard, or let's say not rewrite as in it's it needs to be rewritten. How can it be further enhanced, right? And made it more accessible and usable, and in the bite-sized pieces idea too, I think is, and that's I think what that question was getting to. So So this has again been a really great discussion. I don't see any other. There's some comments in the chat, but I don't see any other questions. If anyone has a question that I've missed and they're still here, put your hand up, and we can unmute you. Otherwise, I will just ask our speakers if they have any final comments related to what we've discussed here today in terms of assessment in general and more broadly, or just workplace mental health and injury prevention, which is the overall theme of our series. And yes, I should remind everyone to do the Slido. It should be a little green button on the bottom of your screen. If it did not come out directly, I would encourage you to just let us know if you learned something and if you might share it, and which helps us with our performance measures back to our funder at the Ministry of Immigration or Labor, Immigration Training and Skills Development. I don't see any other questions. Peter, did you have any final comments you wanted to offer?
No, I appreciate the opportunity to have these discussions. Again, I would just say, for workplaces who are thinking about getting into this space, ensure that there's a commitment from management, ensure that there's opportunities for workers to participate, and think about the implementation. So if you're making changes, really focus on gathering information on how that process is going, because that's the key, I think, to improving.
Great, thank you. And Katrina, did you have anything else?
Yeah, thank you again for having us. Definitely echo what Peter said, and then to add to that, reach if you aren't sure where to start, connect with the HSA that's assigned to your sector. So all of the HSAs are working on on workplace well-being. So there's tons of tools on all of them that you can also go to, even where we focus on the public sector, but if you look at the other ones as well, even regardless of the sector, there's great resources out there, and we're here to help. So reach out if you want more information.
Great. Thanks very much to both of you, and to Liz Horvath. It was a really good session, I think, and a good overview of all the, all the work that's going on to understand how to make a difference in workplaces, and then all the tools that are being developed that are kind of multidimensional. The toolbox gets bigger and bigger, so I really appreciate your attendance today for everyone who's here. I know it's always a busy time, and it's only not one more day to the long weekend here in Ontario, so there's busy times going on. So we really appreciate your time and attendance. And this is the middle session, and we have 2 more weeks. Next week we're hearing about some research, and which will be interesting. 2 of the sessions actually. So one of the sessions is from a speaker who was here for RSI Day, talking about mindful workplace mental health, but it's in the mindful being mindful of people's needs in accommodation and return to work. It's not about mindfulness in terms of fixing the worker. It's about being mindful in your approach to those things. And then Dr. Faraz Shahidi from the Institute for Work and Health will be here to talk about his research showing the relationship between job quality and deaths of despair. So which is a pretty serious topic, needless to say, the relationship between job quality and premature death, essentially. And then we actually have a speaker from England, Sarah Waters, who is the lead on an international study on work-related suicide that's just starting, and Steve Biddle, who was here last year talking about his research in the area, will be here. But Sarah's going to talk about the international study, which I think will be important. We always want to share research results, and of course they're about finding and building on the knowledge. So look forward to everyone coming back, and then in 2 weeks it'll be the Canadian conversation on mental injury prevention across the country. So We have a speaker from Quebec and BC confirmed. We're still looking for someone in the middle. So if anyone has a speaker suggestion, or else we'll be able to talk about Ontario. But anyways, thank you everybody, and we'll see you next week, and have a good and healthy and safe long weekend. Bye.